Commemoration of 2025 World Obstetric Fistula Day, health experts in Northeast Nigeria are calling for increased awareness and action to address this preventable yet devastating condition. Good day, viewers. Welcome back to VDM Health News Update on our program, Your Health, Your World. Often, I remind you guys to subscribe to our YouTube channel, Diaspora Digital Media, to get the latest on health. So listen to what we have today. Medical experts have debunked the claim that voluntarily holding back urine or delaying urination could cause kidney disease, describing it as untrue and without scientific backing. The physician said there was no evidence to back such a claim, noting that only people battling urinary tract obstruction were at risk of developing kidney diseases when their urine flows backward. Urinary obstruction, people suffering with that. Also speaking with the expert consultant nephrologist, Dr. Babawale Bello, and a public health physician, Dr. Aliyu Sokumba, said there was no study to prove that holding back urine voluntarily can cause kidney failure. Bello, a kidney expert with Lagos University Teaching Hospital, said it is unlikely that delaying to pass urine when pressed could cause kidney failure. He, however, explained that there is a form of kidney disease caused by obstruction of the urinary tract. That is when it's being caused. Those who has obstruction of the urinary tract. Yeah. A uterine obstruction, he said, is a blockage in one or both of the tubes that carry urine from the kidney to the bladder. According to Mayo Clinic, a medical center focused on integrated healthcare education and research, uterine obstruction can be cured, but if it's not treated, it can be cured, but if it's not treated, symptoms can quickly move from mild, that is pain, fever, and infection, to severe, that is loss of kidney function, sepsis, and death. Also, according to the experts, signs of kidney diseases or failure are never seen until late. Hence, the need for people to regularly check their kidney function, especially persons living with hypertension, diabetes, and HIV. Try to go for kidney checkup. Bello added, generally, one of the challenges of kidney diseases is that early into the condition, it virtually has no symptoms. And it is one of the reasons why you must go for diagnosis. Because one of the reasons why most patients are diagnosed late is because the symptoms are not there to show. That is why early diagnosis of kidney disease requires patients to go for wellness checkup. There's something called wellness checkup. It's not only when you're sick that you go for checkup. At times, you decide to check yourself, know the wellness of your organs, your kidney, your liver, and other organs of your body. It is at that time when they are well that you can diagnose kidney disease early. That is the time when you are well. Oftentimes, by the time an individual is having symptoms of kidney disease, know that the disease itself has progressed. On warning signs for kidney disease, Bello said if a person experiences urine foaming, that is urine foaming, or excessive urinating at night, persistently, mark the word persistently, there could be signs of kidney issues. They could. So don't take that sign for granted. Also speaking, Sokumba noted that if a patient with kidney infection presents to the hospital early, the condition can be treated. Adding that once the disease has got to the stage where symptoms are seen, the use of dialysis would be employed and then the disease can only be managed from that point onward. That is why whenever you see this symptom, capture it immediately. However, adding to a 2022 study published online by BMC titled Comprehensive Assessment of Holding Urine as a Behavioral Risk Factor for UTI in Women and Reasons for Delayed Voiding. Delay in urination on a habitual basis is associated with UTI, that is urinary tract infection. The study, which assessed holding urine and also investigating the relationship between the frequency of UTIs and overall behavioral features, menstrual hygiene, and attitude of women towards their health issues. By studying 50 women, found that holding urine for a long time proved to be an important risk. That is a very important risk factor for UTI. Up next, in commemoration of 2025 World Obstetric Fistula Day, health experts in Northeast Nigeria are calling for increased awareness and action to address this preventable yet devastating condition. A consultant gynecologist at Yobe State University Teaching Hospital, Dr. Aisha Adamu Bubarada, stated this while speaking with journalists in Damaturu on the significance of the day, emphasizing the need for government and community to prioritize awareness, prevention, and treatment. She said, obstetric fistula, a childbirth injury that leaves women with lifelong physical and social burden, is often caused by prolonged obstructed labor, surgical errors, or unsafe delivery practices. Buba decried it as a heartbreaking consequence of neglected maternal health care. So sad. She maintained that the condition affects thousands of women in low-resource regions, with many cases hidden in northern Nigeria due to shame or lack of access to treatment. Yeah, I can imagine. You won't blame them at much. Recent progress has been made in Yobe, with free surgical campaigns at the Mother and Child Health Hospital, repairing over 100 cases of fistula in late 2024. Buba stressed that obstetric fistula is preventable through strategies such as family planning, early identification of high-risk pregnancies, skilled birth attendants, and emergency obstetric services. Buba also called for expanded outreach and urged women in Yobe to utilize free clinics, insist on facility births, and adopt postpartum contraception. The Medical Women's Association of Nigeria and government agencies are working to educate communities, reduce stigma, and strengthen healthcare systems. That's very, very nice because healing begins with awareness. So, together, we can ensure every woman has the right to save motherhood. That is why we keep giving this information out. If you're a victim, don't be shy at all. In continuation, obstetric fistula is a silent killer. That is a completely treatable health condition, but yet it affects over 500,000 women worldwide. The executive director of UN Women, Sima Bahus, said on Friday in her message for the commemoration of the 2025 International Day to End Obstetric Fistula. Obstetric fistula is a medical condition, let me just break it down well, which refers to the development of a small hole between the birth canal and the bladder or the rectum, leading to leaking urine or feces. You can imagine how deadly it is. Women's bodies become battlegrounds, not only through sexual violence, but through the deliberate denial of reproductive rights and health services. Bahus painted a grim picture of what people living with obstetric fistula went through, especially the complications that it caused during childbirth. 5 days, that is how long it took Da, a 14-year-old prospective mother from Cote d'Ivoire, to give birth. You can imagine. The child was stillborn and she developed obstetric fistula. 16 years, that is how long Da, mentioned before now, had to live with the agonizing condition, undergoing 8 different surgical procedures before finally getting the fistula repaired. Oh, this year's theme, her help, her right, shaping a future without fistula. We seek to make progress towards the goal of eliminating fistula by 2030. In recognition of the over 500,000 women like that who are forced to endure what is a highly treatable condition, the International Day to End Obstetric Fistula is being marked. Yes, because obstetric fistula is often brought on by prolonged or difficult childbirth. Most of the 500,000 women suffering the condition live in the global north. Many women who have a fistula experience social isolation and exclusion brought on by leaking urine or feces. I can imagine. I pity them though. This in turn can lead to depression, yeah, exacerbating poverty, and so many other challenges. Also speaking, UNFPA emphasized that midwives were key to preventing fistula and other childbirth injuries. However, there is a global shortage of over 900,000 midwives, 500,000 of which are in sub-Saharan Africa, according to the UN Population Agency. Reproductive health education and empowerment are similarly essential to addressing and preventing obstetric fistula. Also speaking, Cambry, a small business owner who lives in Borno, lives with obstetric fistula for 23 years. She even had another child before getting medical assistance. She said, I prefer to isolate myself because of the fistula. I couldn't sit for so long for the fear of getting wet. She also learned that it was treatable when listening to a radio show, inspiring her to go to a UN Sexual and Reproductive Health Agency and UNFPA supported hospital for treatment. You can imagine, had even she never listened to the radio, maybe she wouldn't have had this remedy. Yeah, that is why I often tell you to subscribe to our YouTube channel so that you get this latest news. If you're a victim, don't be shy. Please bring it out for it to be solved. Now, Kabiri owns a small pot-making business. She recounted the gory experience of another person living with obstetric fistula. UNFPA set the goal of elimination by 2030, which seems doable given that, as a medical condition, it is both completely preventable and fully treatable. Between 2003 and 2024, UNFPA supported nearly 150,000 surgical fistula repairs, 4,400 of which alone happened in Cote d'Ivoire for women like Da and Cambry. Also, Catherine, a mother of 2 in Buano, also received medical assistance from the UNFPA-supported hospital. Now, she said, I'm healthy, I'm happy, I can run my business and spend time with my friends. So happy for you there. Nevertheless, obstetric fistula has remained stubbornly persistent throughout the world due to disparities in global health systems. The most effective shield we can offer women and girls is their own power, voice, and leadership. So, take note. If you're a victim, try to go to the hospital. Also, after that received successful treatment for her obstetric fistula, she, like Cambry, began a seasonal food business through which she prepares and sells produce. Uh-huh. She has also bonded together with other fistula survivors from Bono to enhance community awareness and reduce stigma. That is why I say awareness is the key. So, when women lead the protest, not only themselves, but their families and communities, the impact is transformative. So, please take note, be aware of this deadly disease, and know that it is treatable. Up next, the Nigerian Senate has passed the Federal Medical Center Act Amendment Bill 2024, which seeks to establish a federal medical center in Kafanchan, Kaduna State. The bill, sponsored by Senator Sunday Marshall Kantun, representing Kaduna South Senatorial District, aims to improve access to quality healthcare services in the region. Reacting to the development through a statement on Friday, Kantun said the new medical center will help reduce the burden of long-distance travel for specialist medical care, which often leads to delayed treatment and preventable death. Wonderful. The new FMC will help reduce the burden of long-distance travel for specialist medical care, which often leads to delayed treatment and preventable death. Also, the senator expressed gratitude to President Bola Tinubu, Senate President Godswill Akpabio, Deputy Senate President Jibrin Barrow, and his fellow senators for their support in advancing the bill. This is a critical step towards equity in federal healthcare infrastructure. You can imagine. It reflects my commitment and desire to attract meaningful development to Southern Kaduna and ensure our people's needs are addressed at the national level, Council said. Also, Council described the passage as a major turnaround for a region that has long grappled with inadequate access to quality healthcare service. Congratulations to the Kadunas. According to Senator Council, the new FMC is expected not only to boost our healthcare infrastructure, but also to stimulate economic development in Southern Kaduna. He said, the center will not only attract direct and indirect jobs, but will attract healthcare professionals, promote research and training, and improve overall public health outcomes. The passage of the bill by the Senate would go along in ensuring the smooth takeoff of the medical center. Well, with this good news we brought to you today, to the end of today's update on your health, your world. Don't forget to click on the like button, share, comment, and subscribe to our YouTube channel, that is Diaspora Digital Media, to get the latest on health. Until I come your way, I am Nene Michaeline Ezine. Thanks for watching. Do have a wonderful day. Bye for now.